Yahiwara ki tēnei tuku, Yahiwara ki tēnā tuku, kia tū, kia oho, kia matara. Nā pai wānanga o te motu tō ki hitonu mai, eke mai nei tēnei rangi nui whakaharahara. Tēnei rā, o te whakarewatanga, o te kura hauora tangata, tēnā tātou i roto i tō tātou kotahitanga, tēnā tātou i whakarauika nei, ki te hāpai ake i tēnei kaupapa. Tēnā tātou nā pukenga kōrero, nā pukenga reo, nā mātanga hauora, tātou nei i tae mai ki te whakaranga hua ake, i tēnei kaupapa ki mua i te aroa. I tēnei wā, ka tuku mihi atu nei ki tō tātou pauarahi kia Steve, tēnā koe. E te menita, Tony, nau mai, hara mai, ki tēnei wharea wānanga o te kūnenga ki Pūrehurua. Whakawhiti atu rā ki tō tātou ahorangi ki a maihana, nau mai e koro hoki mai ki tō whare. Tātou katoa, koutou, aku rangatira, aku whakatamarahi ki te rangi, aku whakataitei ki te whenua, nau mai, hara mai, ki roto i te whakaaro pai, ki roto i te nākau māhaki, i te nākau hihiri, ki tēnei whakarewatanga o te kura hauora tangata. Kia tīmata ake i te karakia, ka mutu ka tuku atu te rākau kōrero. O tira, kei noi tātou. Tō mātou kai whakaora e whakamoimiti ana mātou kia koe ke arahi pai mai i a mātou katoa. Ko tai pai mai ngā wānanga kōrero, ngā wānanga rapu huarahi hau, e rapu nei te pai, te tika, te oranga, kia kotahi mai ai ngā mātanga hauora, kia piri ponotonu. Whakawahitia tēnei tāngo te hauora ki raro i te kupu arahi, kupu manaaki, hei whakatipu i te ora ki tēnei kura, te kura hauora tangata. Whai waihi tēnei tāonga, te hauora ki ngā ritenga pai o te taha wairua, te taha hinengaro, te taha tinana, me te taha whānau wakoranga. Kia arake te hauora whakaore, e hauai te rongo, e marama ai te rongo hei arahi i ngā hāpuri hauora, hāpuri whakawhiti mā tauranga, hāpuri whakapakari mā tauranga, koia nei mātou e whakamoimati atu nei ki a koe. Āmine. Kia ora tātou.
Thank you. Ladies and gentlemen, welcome, good morning. Welcome to the launch of Massey University's new College of Health. I'm Professor Ingrid Day. I think my title up there says Assistant Vice-Chancellor, Academic and International. I'm also the Acting Pro-Vice-Chancellor of the College of Health until the arrival of Professor Paul MacDonald, who we're expecting to see here in April. Welcome to the Minister of Health, the Honourable Tony Ryle. We're absolutely delighted that you're joining us here on this very, very important day for Massey. Also welcome, if he is here, and if not, when he arrives, Sir Peter Gluckman. We're delighted that he has agreed to attend this morning. Welcome to Massey's Vice-Chancellor, the Honourable Steve Mahari, and Emeritus Professor Sir Mason Jury, Professor Sir Mason Jury, our valued partners, members of Massey's senior leadership team. I think almost all the leadership team are here today, and colleagues. And I would also personally like to welcome and to thank the members of the College of Health Executive Group, who are almost all here today. They've worked incredibly hard to launch and begin and commence the new College of Health. It was the vision of Sir Mason Jury that we must acknowledge to bring the College of Health at Massey University into being. And it's also the vision of our Vice-Chancellor to bring it into being and to realise that vision, and he will be speaking to us shortly. Meanwhile, before they do, I want to give you a taste of the great work and the people who are here at Massey in the College of Health, and I hope the video will now
Nutrition in the womb has a defining impact on heart and brain function and our risk of developing diabetes later in life. Fortunately, many of the factors that lead to disease can be improved by nutrition, lifestyle and exercise. At Massey, our research is taking a novel approach, looking at the role of taste perception and appetite regulation and their effects on heart and brain health.
We know nothing about whether New Zealand preschoolers have enough or too much vitamin D. So in 2012, other Massey researchers and I recruited and tested the vitamin D status of over 1,300 young children from all over the country. We're exploring the relationship between vitamin D and eczema and allergies in preschoolers. We also want to develop a tool to help health professionals recognise children who are at risk of vitamin D deficiency.
New Zealand has one of the highest prevalences of allergies and asthma in the world. And although we've seen major improvements in asthma medication in the past decade or so, we really don't know how to prevent allergies and asthma. And that really needs to change. So Massey is looking at novel methods to stop the increasing allergies and asthma rates. And in particular, I'm studying the potentially protective effects of microbes and also investigating the anti-allergic properties of raw milk. And with those studies, we really hope to contribute to the development of safe and effective prevention options which are needed to reduce the burden of these diseases in New Zealand and internationally.
Being healthy isn't just about the kilograms lost or cutting out your favourite fast food. It's about changing your attitude towards exercise and figuring out what exercise works for you. Māori men have a high risk of obesity related illnesses, and my research is all about helping this group make changes.
To meet all these complex and varied health challenges in the future, we need a quality health service delivered by highly competent and skilled health practitioners. By far the largest group of these practitioners are registered nurses, who to meet the future health needs in New Zealand and overseas are required to be competent, highly flexible and have the ability nowadays to lead healthcare teams. Massey University prepares highly regarded competent registered nurses at the beginning of their career and also at the most advanced levels filling positions such as nurse practitioners. We're producing quality graduates who are making an invaluable contribution to the health of people in New Zealand and internationally.
Now I'd like to invite the Vice-Chancellor, Steve Mahari, to the stage.
Tēnā koutou, kia ora mai tātou. Thank you for being with us today. When you're looking at that video, no doubt you're doing what I was doing, and that is realising just how much of your own health you can take care of yourself. By the way you sleep, the way you eat, the way you do exercise, it's kind of an imposition, really, isn't it? You used to think that health was somebody else's problem, you just got on with it and went to the doctor now and again and got fixed. Tony Ryle, thank you very much for being with us today, Minister. We were just chatting before about the fact that we really can't afford that kind of approach to health anymore, because not only is it bad for you as a person who will end up with these health issues, but as a country we're now faced with the same bills that all Western countries are faced with, ever rising ones that in the end we simply won't be able to pay for. So the shift has to be towards the kinds of things that you've seen on the screens. We have to move towards saying, how do we maintain a healthy population so that people don't need to enter the health system looking for expensive health care as much as they do at the present time. Very difficult to prevent. For example, all of us are ageing. That means more age-related issues. But the more we can do of the kinds of things you'll see on the screen, the more we're going to approach this problem in a very different way, and that's what this college is all about. Ingrid, thank you very much for your introduction, and thank you for the role that you have played in the College of Health establishment so far. Thank you to all of the establishment team who have been involved. Many of you are here today. This college is spread across 3 of our major campuses, which means here in Wellington, in Palmerston North and in Auckland at the Albany campus as well. So there are staff who are involved right across the whole of those 3 campuses. Thank you very much for all the hard work that you have done. Can I again thank Tony Ryle for being with us today. As a Minister, he has been very clear about the need for us to focus on these kinds of issues, and we hope that you will find in this College of Health a relationship that will help you in the work that you do going forward. Mason Jury, it's great to see you here. I think you're a living example of what we're trying to do. Every time I see you, it is a little bit that you've retired, of course, I guess, or re-careered, or you're freewheeling, or whatever the word is now. But you look healthier and more tanned every time I see you. So I don't know if you know this, but Mason has a secret weapon that I discovered over a cup of tea recently, and that is Mason's property has 12 miles of lawns. 12 miles, and he mows them himself by hand. We were going to give him a ride-on mower, but he doesn't want one. He wants to carry on being as healthy as he is. But so Mason has been the driving force of getting us to this point in terms of the work that we have done, and he will talk to us a little later on. And if Sir Peter Gluckman arrives during the time, thank you to Sir Peter for the relationship that we've formed with you over the last little while around not just health but many other issues that we have been involved with. To the colleagues who supported right through the university, supported this whole project, whether they're in health or outside health, thanks to you. It's a red letter day when you can launch a new college and a university. It starts a whole new tradition of intellectual work that's important for us as a university, but also for the people we serve. So whether you're in health or outside health, this is a proud day for all of us to be involved in this particular issue. Very quickly, let me tell you how we got here. This university has a strong relationship with the issues of health, of course. Our vet school, for example, has always been a real beacon of discussion about health. That has also focused on human health. For example, the One Health model that people like Nigel French are involved in now is all about the relationship between health of animals, health of people. The transference of infectious diseases, for example, is something that Nigel and his team focus on. That's been a big issue, and people have often argued that maybe the vet school is a precursor to also having a medical school. But I think we probably agree there are enough medical schools in New Zealand. They do an outstanding job. And so our debate has moved towards saying, so how do you contribute to the kind of debate that I mentioned at the beginning of my comments? Now, a number of people in the room, I think, can quite rightly see themselves as the precursors of this college because they came into what was a fairly pluvial discussion running towards the big stream that led towards what we are doing here. By contributing to saying, look at what we're doing in sport, look at what we're doing in nursing, look what's happening in nutrition. Maybe there's something bigger that we could get out of all of this work that we are doing at Massey. Now, we began a program of academic reform about 2 or 3 years ago. That academic reform program said we're going to challenge each of the colleges, the academic community, to say to us in 10 years' time, looking down the horizon, what do you think we should be doing as a university to match the needs of this country and the needs of the globe? What should we be doing? And one of the strong answers that kept coming back was we need to move towards all this capacity that we've got in the university forming a College of Health. And so that's where Mason came in. He was the person who chaired that original committee and brought the whole project to a head. And then Ingrid Day and the team took over from there, and now we're waiting for Paul MacDonald to arrive from the University of Waterloo in Canada to be the Pro-Vice Chancellor. Now the focus on social determinants of health and the way we organise the delivery of health for maximum impact is what we hope to contribute. And I think New Zealanders understand that this is the way we should go. There was a survey done as part of setting up the college of 1,300 New Zealanders, and the question was simply, what do you understand would improve your health? And not unsurprisingly, they came back with things like obesity, like cancer, like lack of exercise, these basic issues that can be addressed through the way we live our lives. If we could address those, then we would be a healthier population. So we can see that this is going to ring true with the New Zealand audience. They're going to say, yes, we want to hear more about how we can live healthier lives. And of course, this is something that we can contribute to all around the world. These problems are not just here, they are all over the world. So that's going to be the focus of our contribution. So once again, thank you very much to the folks who have brought us to this point today. We appreciate all your hard work. Of course, this is just the beginning, and now we move on to establishing the college through this year as an entity, and then move on to, hopefully, a program of work that will contribute nationally and internationally. Now it's my pleasure to move to the introduction to the person I was mentioning before, and that is to ask the Honourable Tony Ryle to come and say a few words. As I said before, while you're making your way to the stage, Tony, it's one of the most difficult portfolios in any government, and you have been, I think, a real definer in terms of what we are doing in health. So thank you for being with us today.
Kia ora koutou. Good morning, everybody. Thank you very much for the privilege of being here today to join with you at the launch of the College of Health here at Massey University, the educational institute of the finest minds in the New Zealand government. Can I acknowledge the Vice-Chancellor, Steve Mahari. Thank you very much for the leadership, the enthusiasm and the commitment, dedication that you bring to your role here at Massey. Also to acknowledge Sir Mason Jury, who's speaking after me. Thank you for so much that you have given not only health, but the community of New Zealand over so many years. Your classic determination, your bearing and your strong focus on what really is important is an inspiration to so many people, and I just want to acknowledge that even while you might be emeritus, your commitment and engagement in public life in New Zealand continues, and I'm sure everybody in this room would want to join with me in thanking you for that. This is a very important opportunity for me to be able to come and thank you and congratulate you for forming the College of Health. There's no doubt that one of the mega trends in health is this multidisciplinary team approach, where we now recognise that practising in isolation is a recipe for disaster, and the fact that your college brings together so many disciplines under one roof in a spirit of cooperation is really testament to the fact that you're on to where the future's going. Because many of our top experts in health would tell you that some of the key diseases in health, we're going to see demand for dealing with those diseases double over the next 10 years. And quite clearly, we're not going to be able to double our investment in health. So we have to move health to a new platform, a less expensive platform. And that platform is primary care and in the community. And underlying all of that is the very important investment that can be made in prevention and public health initiatives. It's pretty tough around the world. The latest OECD data shows that New Zealand has had the 4th biggest increase in prevention and public health investment over the last few years. And that's an indication that our government takes very seriously the importance of investing in prevention and public health. We've focused on fewer, more important and high impact initiatives in public health as we've sought to focus our spending and our investment on what we call our priorities for prevention. And many people in this room have really contributed to some of the great successes that we've seen. And even some of the most basic preventative measures like immunisation, for example. It was only 4 years ago that we had less than 2/3 of our 2-year-olds in New Zealand fully immunised, where we now have 95% of our 2-year-olds fully immunised. And what makes it even more significant is that there is now no gap between Maori, Pacific and other New Zealanders in terms of those immunisation rates. In fact, Maori are now some 20% higher in immunisation than where Pākehā were when we started 4 years ago. So it's been a huge significant effort by the Public Health Service. We've created a turning point in the fight against tobacco with significant tax increases, screening of all patients both in hospital and primary care, and we're seeing the results. Our smoking prevalence in New Zealand, the lowest it's ever been, heading down in some of the key demographics, and those things are working. Rolling out nationwide screening for more diabetes and heart checks is having a huge impact. We're getting that up as well. But thank you also to the investment of so many people in this room in the government's rheumatic fever program. We're investing $24 million over the next 4 years in combating this third world disease. Many of you are also involved in the work that we're doing to improve nutrition and exercise with New Zealanders. Professor Gluckman, who will be here later on, has advised the government, and I see it's picked up in much of what you were talking about the need for this key intervention point in maternal and newborn nutrition. And recently some research came out of Auckland which indicated that if we can make those changes in terms of lifestyle, nutrition before the age of 4, we can make a significant impact on unhealthy weights in New Zealand. So thank you very much for the opportunity to be here and to acknowledge some of the great work that you're doing. This is the space where the future of health is so important, and I want you to know that the government certainly appreciates all the work that you're doing, the contribution that you're making, and we're looking forward to seeing some of that great research and great people flow out of this great institution. Thank you very much.
Minister, can I say, just looking at you on the stage there, you all know that politics is a killer. People usually end up looking about 50 years older than they are after the first 6 months of becoming a minister, but you seem to look younger and you're slim and all those kinds of things. I just say this in hopes that the health funding dollar will come towards us over the next little while. And I should say, while we're having this orgy of congratulations for Mason and the Minister in terms of their fitness, I want to reveal today that if you haven't already donated to my Oxfam 100-kilometre walk, you can click onto my website and donate directly to them, and 2 toilets will be provided for people in the Pacific Islands, full bathrooms, not just the toilet, full bathrooms by my walking 100 continuous kilometres over the next little while as part of Oxfam. What are you doing, you might say to yourself, to keep yourself healthy at the present time? That's the question you might ask. Mason, let's turn to you. And a lot has been said about you already, and I know you hate that. So I won't say anything more than to say that we're very delighted that you made the trip today to be with us, and that we're looking forward to the words that you might have to say to us. Please welcome Sir Mason to the stage.
O tira hakopa, tēnā koe nā i whakatau mai a tātou I roto I tēnei kaupapa, tēnā hoki koutou katoa, ko tae mai ki tēnei papa o te kuninga ki Pure Huroa. Well, thank you and congratulations to all of you who have been part of this venture. Thank you, Minister, for your comments. Actually, I thought you were going to give me a little bit of a job description there for the years to come. And thank you, Vice Chancellor. My children say I look a bit skinny rather than slim, because I tell them it's all 100% muscle, so it's all good. But 100 years ago, almost to the day, it's early March 1913, a ship arrived in Auckland from Vancouver. It was called the Zealandia. And on board the ship was a missionary who was going to do some work with Maori in the north. He'd been up there a few days, felt unwell. People thought he had chicken pox. In fact, he had smallpox. And he was in close contact with a large number of people, and fairly quickly the smallpox spread, people still thinking, hey, is this an unusual form of chickenpox? And the people who had been at the meeting in Auckland then went to Rotorua and followed them. They were followed by the smallpox bug. It could have been a disaster for New Zealand. If you look at other countries where smallpox epidemics have taken hold, the results have been absolutely disastrous. New Zealand's experience in the 1913 epidemic was not like that. It wasn't a disaster, and the epidemic was reasonably well contained. It hit particularly Maori communities because that's where the missionary was working. God's word had another meaning. And these were people who were struggling anyway in 1913, and the smallpox did nothing to help. In the event, some 2,000 cases were reported and 55 people died. That sounds like a heavy toll, but compared with the First Nations of Canada, when they had a smallpox epidemic, and in the United States with North American Indians, it was a small event. The reason it was small was because people at that stage knew quite a lot about prevention and certainly knew, Minister, the impact of immunisation and vaccination. And two of the people that played a big role in stemming that epidemic were two young Maori doctors. One was Maui Pōmare and the other was Te Rangahero, Peter Buck. Both were knighted, which seems to be a fate of doctors, of Maori doctors. But Maui Pōmare was in the Ministry of Public Health, Department of Public Health, responsible for Maori health. Peter Buck at that stage had worked with him in the Department of Public Health, but had also gone into politics, and at that stage was the member representing Northern Maori. Those two gave up their regular duties for 3 months, walked the country, talked with people, visited every marae in the areas that looked like they might be affected, stood on railway stations, visited Maori Land Court, went to marae. Everywhere they went, they vaccinated people against smallpox, and they supported those who looked as if they might be developing smallpox. The vaccination program was a huge program that they undertook. It was, of course, the days before informed consent. There was very little option about whether you were vaccinated or not, but their work paid off. It was stemmed, the epidemic was stemmed. It didn't develop in the way that it might have developed, and we had shown as a country then, thanks largely to the two I mentioned, who worked with their own people. What they showed was that a commitment to prevention and strong leadership can produce great dividends. And that's what I think is so great about the College of Health that we're celebrating here today, 100 years later. There is a commitment to prevention. There's a commitment to having lifestyles that are going to ensure that the next generation of New Zealanders are well. And there is strong leadership. The leadership, as we've heard, comes from the people who have high expertise in a whole range of disciplines. And that's the breadth and the depth exists. But importantly, the leadership will be a collective type of leadership, distributed, and it is the coming together of so many disciplines that will make the huge difference to what we've been doing in various units relatively independently for some years. So I think it's the merger of disciplines that is going to provide the answers. The risks to health today are not the same as they were in 1913. There is still some concern about infectious diseases and the question of rheumatic fever. Good to see that there's programs to address that. But the risks to health now are so very different to what they were in 1913. They're linked to the food that we eat, which is pretty different to 1913. There wasn't much food to eat in 1913. They're linked to the houses we live in. They're linked to the environments that we're in. They're linked to the work that we do and the circumstances around the work that we do. They're linked to access to primary care facilities. So the risks are different, and if we're going to address those risks in a new way, then the strong, distributed and collective leadership is going to be hugely important. So I think it's great that in a relatively short time this college has built on the initiatives that were established previously at the university, brought them together, to establish what looks to me like a strong college that will make a difference to New Zealand's health and will contribute to the global Millennium Health Goals that the United Nations established in the year 2000. So best wishes for the future. The college is looking good. I think you will have the capacity to transform an approach to health. So kia kaha, be strong, kia maia, persevere, and stay well, kia ora.
I'm sure you agree with me, this is a great privilege to be able to come here and do this.
Would you mind reading the plaque?
And the plaque says that the plaque commemorates the official opening of the College of Health Te Kura Huora Tangata, opened on the 21st of February 2013 by Tony Ryle, Minister of Health. Congratulations.